right. I can't believe annual enrollment is already here. We'll give it a few minutes. So we're going to do YouTube Live, and then we'll jump on Facebook. But in this video, I'm excited to cover the 2023 changes to Medicare. We actually have some good news, some reductions in some of the costs. So I'm going to give it a few minutes. I see a few people have joined. Let's see here. All right. Just trying to see. I wonder if there's a way. Let's see. Okay. Oh, yeah. Let's see if we can post it to here. No, we can do that next time. All right. Thank you for joining. I'm just allowing a few more people to join in this video. For those of you who do not know, my name is Robert Bache, MedicareBob. I'm founder of Senior Healthcare Direct. It is that time of year where it is time to shop our Medicare coverage. And so I've got lots of interesting information. I'm going to cover the changes to Medicare for 2023. What's nice about some of the changes is that so there's some reductions in Medicare, especially in Part B, the Part B premium and the Part B annual deductible, which will make Plan G and Plan N more favorable if you have supplement coverage. Okay, so the camera is actually that camera, not here. Interesting. So I thought I'm like looking down. All right, so we're going to jump into it. So again, thank you for joining, and I'll share this on some other social platforms as well. Again, I'll introduce myself one more time. My name is Robert Bache, MedicareBob, founder of Senior Healthcare Direct. I'm on numerous platforms. I'm a Forbes contributor. I'm on Your Advisors, different websites and stuff like that. I've been in the Medicare space since 2008. Have millions of views on my YouTube, a few 100,000 followers on Facebook. And it's a pleasure that I've been able to help people for so long with their Medicare. I am the founder of Senior Healthcare Direct. We are a full service Medicare agency. We help with Medicare Advantage, Medicare Supplements, Part D, and dental, vision, hearing, cancer coverage, hospital indemnity, all the stuff that people need for senior healthcare to help live healthier, longer lives. In this video, I'm going to talk about the changes for 2023 to Medicare. So let's start with the premium. So for 2022, the standard Medicare Part B premium is $170.10. That's the standard premium. Some people might be paying less if you qualify for LIS, which is low income subsidy. Some people might have to pay more, which is called IRMA, income related monthly adjustment amount. But the standard premium for 2022, which is normally withdrawn out of your Social Security check, is $170.10. Got great news. That's actually being reduced, not by a whole lot, but it's better than an increase. So it is being reduced for next year in 2023 down to $164.90 a month. So not a huge savings there. You know, it's about $5 per month. But the way I look at it is, yeah, it's not a huge reduction, but instead of it being a $10, $15, or $20 increase, it's a $5 decrease. So, you know, hopefully it's definitely better than the alternative, right? Now let's go into Part A and B, the coverage differences. What's interesting to me when I look at Part A and the changes for 2023 is it seems like the government decided to go to even numbers. If you look at 2022, the Part A deductible, so that is the amount of money that one would have to pay every time they go into the hospital if they only have Medicare. And in 2022, that amount is $1,556. In 2023, that's actually going to increase to $1,600. So that's, again, it's going to increase by about $44. The key thing to understand about the Part A deductible is that if you're admitted into the hospital, that's what you're going to pay if you only have Medicare. It's not per year. I think a lot of us associate the word deductible with something that we pay a year. The Part A deductible is per occurrence. An occurrence is a 60-day period for the same reason that you were admitted into the hospital. And so it's going up from $1,556 to $1,600. If, God forbid, you're admitted in the hospital longer than 60 days, because that's how long that deductible covers you, In 2022, the amount that we're paying now is $389 per day. That is actually going to increase in 2023 to $400 a day. Also, with Medicare Part A is a skilled nursing facility coverage. So with Medicare, Medicare does cover days 1 through 20 at no charge for the beneficiary. However, starting day 21, there's a copay per day that you're in a rehab skilled nursing facility. In order to qualify for skilled nursing facility, you have to admit in the hospital for 3 days. And so if you're not sick enough to be in the hospital, but not healthy enough to go home, they will transport you into a skilled nursing rehab facility. The first 20 days are always covered by Medicare. However, starting day 21 to day 100, there is a fee associated with that. And that fee in 2022 currently is $194.50. And Medicare, again, staying with the even theme, is actually going to increase to $200 per day. So not a huge increase, but it's $200 a day instead of the $194.50. So everything in Medicare Part A has increased as far as the out-of-pocket costs. Medicare Part B, on the other hand, we have some good news. I already shared with you that the standard premium in 2022 is $170.10, and that it's going to be reduced down to $164.90. Again, not a huge savings, but better than an increase, right? With everything else, it seems like going up, either shrinkflation or inflation, or however you want to say it. At least, at least the Part B premium did not increase. Again, that's the standard premium, as I talked about. If you have IRMA, you're going to pay more. If you have LIS, you'll pay less. Some great news is the Medicare Part B annual deductible. So this is the Part B deductible is applied to everything outside the hospital. So a doctor that touches you, outpatient procedures, diagnostic testing, x-rays, imaging, MRI, CT scans, all those items that are outside of the hospital, lab work, all those things, that's covered under Medicare Part B. And the current Medicare Part B deductible is an annual deductible of $233. And in 2023, drum roll, it is being reduced. Again, nothing major, but it's going down to $226. So again, it's better than the alternative, it increasing. So it's going from 233 to 226. So, overall Medicare stayed pretty stable. It's almost like it's an election year or something for the Senate and Congress. They kept Medicare really stable, didn't want to upset the voters, right? And they did reduce the Part B premium and reduced the Part B annual deductible. So how does this impact you now that we're, going into, it's October 4th, annual enrollment periods here. You're going to start seeing a bunch of TV commercials. What should you do? What should you not do? Here's the deal. First of all, you can follow my videos on YouTube and Facebook, and I lay all of this out, but I see that we have some more and more viewers showing up, so I'll share this with you. The first thing you should do is in September, your Medicare Advantage and or your Medicare Part D provider is required to send you an ANOC notice, which is your annual notice of change. So the first step is understand the changes your plan is making. The reason that's important is we're already seeing it now on October 4th, tons of commercials about Medicare plans, new benefits, new this, new that. And yes, there are some really exciting new benefits that are coming out in Medicare Advantage plans and Part D, and I'll cover some of those here in a moment. But you might change your plan when you don't need to because you see on TV that there's a new benefit that a plan has. And if you don't look at your ANOC notice, you may not realize that your plan that you have now is gaining that benefit in 2023. None of this stuff is fun. Okay, there are tons of other things you want to do other than shop your insurance. But if you are going to shop your insurance, it is very important that you understand, one, is your plan renewing? Because if your plan's renewing, you do not have to change your plan. How is your plan changing? Your plan is most likely going to improve. There is more and more money that the government is putting into Medicare Advantage plans. So when you hear about these new benefits, those new benefits might be applying to the plan that you already have. So the first step is understand how your plan is changing. And also, two things: make sure that your plan's renewing, because if it's not renewing, then you definitely need to shop your insurance because you need a new plan. If your plan is renewing and you can keep it, spend a few minutes, look at the documentation, the annual notice of change document, and see what your plan's adding. Your plan might be adding $500 of dental. Your plan might be adding a flex card. Your plan might be adding stronger hearing aid benefit, lower doctor copays. It might be adding better or lower cost drug coverage. So I'm always a big fan of understanding your plan. Now, a lot of this stuff is foreign if you don't do it every single day like our agents. So if you would like help evaluating your plan, what's nice about Senior Healthcare Direct is we're a service agency. So if you speak with one of our agents, we're going to help you understand how your plan is changing. If you're okay with those changes and you don't need to change your plan, we'll advise you to keep your plan. But in order to change your plan, the first step is, one, is it renewing? And if it's not, then you need to shop. Give us a call. We're happy to help. If it is renewing, cool, great. Maybe you just keep it. Maybe you still shop it and compare. But the first step is understanding what you have. So here's a sneak peek. Medicare Advantage is very regulated. So I'm not allowed to go into plan specific. So I got to keep it very general. So I can't mention like this carrier is adding this benefit. This carrier is reducing that benefit. I'm not allowed to say that. I'll lose my license if I do that. But I can talk about Medicare Advantage in a generalization type of way. And what I'm seeing from now that the plans are out is we are seeing more and more companies adding that flex card. Now, the flex cards are really, really cool. It's basically money to help you have healthy living style. So you might see a flex card that has a $1,000 benefit flex card. Okay. Now you need to understand that not all that $1,000 can be used towards one thing typically. Most of the time, the flex cards are going to have caps on certain items. So like what we're seeing on caps is you might have a flex card that has a $200 cap on the dental coverage part of it. So you have 1,000. So again, this is where the advertisements, in my opinion, are a little bit misleading. Okay. CMS, which is Medicare, is really trying to reduce the amount of misinformation out there, but there's still going to be those people that are behaving badly and those large companies that are on TV commercials, and they're not telling the whole truth, right? But so when you look at a flex card and it says it's a $1,000 benefit flex card, typically there's going to be portions and caps to how you can use that flex card. $200 may be the limit towards dental. $150 a month might be the limit towards, sorry, I'm getting some messages here. Okay. So like $150 might be the limit towards healthy groceries. Okay. But those flex cards are really awesome. You want to understand it. So make sure that when you're talking to an agent and you're choosing a plan and the flex card is one of the reasons you're choosing the plan, ask those questions. Well, how much per month can I use on my flex card on groceries, on dental, on vision? They're still not bad. I just think it's misleading because when you see the TV commercials, it says $1,000 flex card. Okay. Now, flex cards are not available on every plan and they're not available in every area. Just like you're going to hear a lot about Part B rebate or get your Part B reduction premium. Okay. Again, these TV commercials that air nationally, they're a little bit misleading because in some areas, there are not flex cards. In some areas, there are not any Part B reduction plans. So what you have to understand about Medicare Advantage plans, these are those Part C, zero premium advertised plans, is they are county specific. Okay, so a carrier plan in one county can be very different than a carrier's plan in another county. So if you have family or friends that live in a different county and especially in a different state, you might have the same carrier, but the plans can be very different. So it's just really important that you speak to a broker like Senior Healthcare Direct, our office, that offers the multiple plans. Okay. It's very important. Now, we do not offer every plan. Okay. If you want to review every single plan all by yourself, you can go to Medicare.gov or call Medicare at 1-800-Medicare, and they have access to every plan. So that's an option for you as well. In my experience, our brokers do a great job. A good broker is going to go over the ins and outs of the benefits. They're going to get a list of your providers. They're going to get a list of your prescriptions, and they're going to find you a Medicare Advantage plan that suits your needs. Um, also, feel free to do some questions. So I see one here. So Roger Duke just asked a question. What is this 800 service call that keep calling you about your Medicare rewards? Great question. Roger, those are what we call TPMOs, third party marketing organizations. Medicare itself will never call you to talk about your benefits. Those are companies, are those misleading advertisement companies that are calling you to try to get you interested in talking about your Medicare coverage, and then they're going to transfer you to an agent or broker who's purchasing that lead, you as a lead to that. So, is it good? Is it bad? Right? Well, it's to me, it's both. Right? It's bad because there's so many phone calls that we get. So, it's hard to weed through the good ones and the bad ones. But if you get a call and it helps you talk to a good agent or broker that gets you a more suitable plan for you, then it was worth the hour conversation, right? So annual enrollment is October 15th through December 7th. The new plans came out October 1st, so we have access to the new plans. It's not fun to shop insurance, but shoot, we've paid into Medicare our whole lives. So we do want to get the most out of our Medicare. So if spending an hour and a half on the phone with a broker and agent can help you do that, I think it's worth it. Selfishly, I'll plug our company. If you call the number that I have listed there, 833-463-3262. Look, we're in business, right? I need people to speak to. I need people to help. We need people to enroll, right? Otherwise, I wouldn't be in business. So I can tell you we do a great job. We do annual reviews with our customer. We're located in the United States, so there's no overseas or anything like that. You're talking to a licensed agent when you call in and get transferred to one of our licensed agents. Everybody's here, either in Florida or Texas is where we have our two agencies. So it's a lot of calls, but at the same time, it's worth spending an hour and a half. You have October 15th through December 7th to speak with somebody. If you can go from a plan that doesn't have a flex card and can give you $1,000 towards groceries, towards over-the-counter meds, towards dental, vision, and hearing, that's worth an hour conversation. If you currently have a plan that is requiring you to pay the full Part B premium on the Medicare Advantage side, and next year there's a new Part B reduction premium, meaning that instead of you paying the $165 a month out of your Social Security to Medicare, the insurance company pays you back. That's pretty cool, right? I know it's not fun. So my advice would be call us, work with us, or work with a broker. Okay, I'm big on education. I don't want this to be a completely selfish plug, but I do know we do a great job. I mean, I've been around forever now. If you guys see my early videos and stuff, I've aged quite a bit actually. But if I think it's worth the time to make sure you have the right plan. And because there are so many benefits out there. But the cool thing is, Roger, the last thing I'll say is once you make your decision, then you can just ignore the calls. Like just ignore the noise. You made a decision on your plan. If you work with a broker like us that offers multiple carriers, then you're good. Like you don't need to talk to anybody else. Like you gave us the doctors, you gave us the meds. We talked about what's available and you made a good choice, and you can worry about your, October and November and December and all the holidays and stuff that come along with that. So thank you for your question, Roger. And feel free if anybody else wants to leave a live question in the box. I'm happy to answer that question. You can call in. We do have agents that are working today at the number that I've listed on the chat, 833-463-3262. All right. So we talked about Medicare Advantage quite a bit. Talking about Part D, really excited. Okay. The government does a lot of stuff or doesn't do a lot of stuff. But they did do something big time, which is they really lowered the price of insulin. Every Part D plan now has certain insulins at $35 copay per month. For those of you that are not diabetics, that may not seem like a big deal, but diabetes is really very, very common, at least within, we enroll about 30,000 people a year. And, I would say at least half, and I'm not looking at data, but at least half of those people have diabetes. And getting insulin for $35 is quite a savings per month. So make sure if you're on insulin, this is a good year to shop your drug plan. Obviously, we can help with that too. I'm really excited about Medicare supplement insurance as well. Medigap. So just a quick education or refresher. Okay, there's two main types of coverages that you can choose from. Feels like there's 100, but there's two. It's either Medicare Advantage or Medicare Supplement. Medicare Advantage is what I was speaking to briefly. That's the private alternative to Medicare. It's what you're seeing all the commercials on. It's the plans that are HMO, PPO plans. They're advertised as zero premiums. Sometimes they have an additional premium. Sometimes you get some of that premium back. You have copays and different lists of copays. Sometimes a deductible, out-of-pocket costs than Medicare charges, but you do have costs up to $3,000 to $10,000 depending on the plan that you choose. Those are good options. There's nothing wrong with those, but it's you have a network and you have to go to certain doctors and some prior authorizations. But they're cheaper per month. Now if you are willing to pay an additional premium, and you want to get a Medicare Supplement and Medigap plan, these plans are more comprehensive as far as how they work with Medicare, because they work with Medicare. So you would stay on Medicare A and B as your primary insurance. So you're $164.90 per month. Starting next year, that's the Part B premium. It's going to go to Medicare still instead of the private company. So it's going to stay with Medicare. You'll still use your Medicare A and B, red, white, and blue card, which means you keep your right to go to any doctor, any hospital. You're going to pay an additional premium, anywhere from $85 to $150, depending on your zip code and age and the plan that you choose. But in return, you get two main things. You get flexibility and predictability. Flexibility, I already touched on. You're keeping your right to go to any doctor, any hospital. You don't have to get referrals. You can travel nationwide with the plan. You're not restricted to a county. And the supplement predictability, it actually pays the bills. So in 2023, if you have a Plan G or a Plan N, which are the two most comprehensive supplement plans for next year, if you turn 65 after 2020, then if you go to the hospital, instead of you paying this $1,600, then your supplement Plan G or N will pay that for you every single time. If you're admitted in the hospital and you're there starting day 61, instead of you paying the $400 a day, your supplement pays that for you. If you use the doctor, or outpatient, or lab work service, that Part B deductible is being reduced from $233 to $226. Well, Plan G pays the hospital bills, pays the 20%. The only item it doesn't pay for Medicare A and B is that Medicare Part B deductible. So if you have Plan G, this is a great year for you, because that deductible just decreased from $233 to $226. So with Plan G, once you pay that $226, you have no surprise bills. Anything that's medically necessary and covered by Medicare will be covered by Medicare Parts A and B, and then that Plan G supplement. Plan N is a great option as well. So maybe if you're someone that, the Plan G premium is a little bit too high for you, then the Plan N is a great option. It has 4 out-of-pocket costs. It has that Part B deductible, which is $226. With G, you'd be done, right? But with Plan N, you would have to pay up to $20 copay when you go to the doctor, $50 copay if you go to the ER. But if you're admitted, that's waived. And then you have to pay what's called a Part B excess charge. What's a Part B excess charge? Well, every doctor that accepts Medicare has one of two contracts. They can either accept what's called Medicare assignment, which means whatever Medicare says they can charge, they accept, they don't negotiate. Or they can decide not to accept Medicare assignment and negotiate. If you have Plan G, it doesn't matter. It's going to pay either way. But if you have Plan N, you might have to pay a percentage of the up to 15% of those Part B excess charges, which is when a doctor negotiates more than what Medicare assigned to that. Something that's really, really important that I don't think enough people know is you do have to medically qualify to get a Medicare supplement plan. The only time in your life that you're automatically approved for a supplement is when you're new to Medicare Part B, unless you have an extraordinary circumstance. So I talk to a lot of people when they first turn 65, or now we're retiring, some of us a little bit later, closer to 67, 68, some of it's 70. Um, so when they go on Part B, they are automatically approved for a supplement, but they still feel pretty healthy and all that. So they think maybe I'll go with Medicare Advantage. And then if I get, as I get older and I age, and if I get sick or get injured, then I'll upgrade to a supplement. That's risky because you may not be healthy enough to do so at that point. So it's really important that when we're purchasing insurance, we're not purchasing insurance just for the now. We're purchasing insurance for the future. So if you work with a good agent or broker like our office, they should, they're going to help you think of that, and then you make a decision, and then you'll be in good shape. A couple things more about annual enrollment, and then I'll wrap it up unless there's some more questions. Again, the dates, the new plans are out. It's October 1st. So you can shop your drug plan. You can shop your Medicare Advantage now. The 2023 plans are published. But remember, the first step with shopping your plan is understand the plan you have. Your carrier was required to send you an ANOC notice, an annual notice of change. If you threw it out because you thought it was junk mail, no problem. Our agents have access to all the plans, so we can even help you understand how your plan is changing. The other thing that you're going to shop is make sure you have your doctors ready. Make sure you have your medications ready. Now, when it comes to your providers and doctors, they should influence your decision if you're choosing a Medicare Advantage, but it can't be the sole reason that you choose an Advantage plan, and I'll explain. You sign an annual contract with the carrier when you choose a Medicare Advantage plan. Your doctors do not. Your doctors can join and leave the network at any time of the year. So it's still important that you provide your providers and doctors to an agent or broker that you're working with when you're shopping your plan. But again, just because they're accepting it now doesn't mean come June of next year they're going to accept it. I'll give you an example. My mom has a carrier, and my mom's flipping out with me. We're going to shop her plan because all of her doctors are dropping that particular carrier. Now I'm trying to calm my mom down because I've seen this before, and a lot of times it's just unfortunately the beneficiaries and the patients are victim to provider networks and carrier insurance companies negotiating. And just like anyone who's bought a car, what does our mom and dad teach us? You got to be willing to walk away from the car, right, to get the best price. Well, that's the game that these systems are playing. The carrier insurance companies and the hospital systems or provider networks is they're negotiating. Okay, it's about money. We're a for-profit healthcare situation in America, so they're negotiating. And so one form of negotiation is, well, fine, we're not going to accept your insurance anymore. And so now if you're a provider, we're not going to accept your insurance anymore. So now you're going to really upset the people that are on your plan, and they're going to leave your plan, and then the plan can do the same thing. Well, we're not going to have you in our network. So now all your patients. So it's just a negotiation tactic. In my experience, they typically work those things out if it's a large group, a provider group with a large carrier. But yeah, my mom's already, a little bit nervous because nobody likes to change all their doctors, and literally all her doctors, it's a carrier and a provider fighting right now. So, but I'm going to help her, be prepared to find a new plan, but I'm probably going to wait until it gets closer to December 7th before I change her plan, just in case, because she's happy with her plan and she loves her providers. She's just a victim to them negotiating. So, also with your drug plan, okay, a few things when you're shopping your drug plan, I'm going to give you some terms here that are very, very important. Okay. The main thing is annual cost. So when you're shopping your prescription drug plan, have your medications ready. Okay. If you're doing it yourself, that's fine. Agents and brokers, by the way, there's no fee. Whether you work directly with Medicare.gov, you won't pay a fee. If you work with the broker or agent, you're not going to pay a fee. There are nuances to Medicare. We have to do annual certifications with every carrier and Medicare every single year because there's a lot of things that are like landmines, okay, as you're navigating through the Medicare maze that a good broker and agent will help you avoid. And there's no additional fees to work with them. So some of those I'm going to give you now. Okay. That's why you guys follow me. I like to educate and provide these things to you. So a few landmines to as you're shopping your drug plan. The first thing is don't be premium focused on your drug plan. I'm not saying the premium's irrelevant. I'm saying the premium is one component. When you're shopping your drug plan, the most important when it comes to a cost and you're selecting your drug plan, the most important thing is called your estimated annual cost for next year. So if you're working with a broker, write that down. Annual cost. Annual cost is going to be an accumulation of your monthly premium times 12 months, your deductible, if you have one, all of your copays in all the different stages. So for those of you that follow me, you know there's 4 stages. There's the deductible stage, the initial coverage, which is the copay stage, the coverage gap, which is the donut hole, and catastrophic coverage. Okay. If you work and just worry about the annual cost, you're good. That's the plan that is going to get your attention. So you provide your medications either into Medicare.gov system or to a broker. They should sort them by estimated annual cost. Don't go sign up for that $12 drug plan because you think it's the cheapest one, because it's not. Because that $12 drug plan might put you in the donut hole in April, or that $12 drug plan might get one of your prescriptions for $100 a month, right? So what we care about is annual cost, because that's going to be your monthly premium annualized, so times 12, plus your deductible and all those phases I said about. So that should be the first way. That's your starting point for your drug plan. Now, some landmines to avoid when you're looking at a drug plan. There are 3 cost control mechanisms that carriers can use to control their costs on your drug plan. And I'm ashamed to say it. I don't think our industry does a good enough job of explaining this to Medicare beneficiaries. It's step therapy, quantity limits, and prior authorizations. So I'm going to go in reverse order there. So prior authorizations, those are not super hard to get, but it is a landmine. If you take an expensive medication the drug plans each have what's called a formulary. A formulary is a list of covered drugs. Not all formularies across the drug plans are not all the same. Different drug plans can have different formularies. And there's what's called tiers. Tier 1 to tier 5. I think now there's even a tier 6. So tier 1 is the lowest cost. Tier 6 is the highest cost. So you can have a drug on a different formulary, but if you're taking like a tier 4, 5, or 6, you might have what's called one plan might have what's called a prior authorization, which means you need to get a document signed by your doctor before the insurance company will fill that for you. That seems silly to me because the doctor prescribed it. So why would you also then have to get prior authorization? But I'm not here to change the world. I'm just here to play in the guardrails that we are in, right? I'm a bowling ball and I'm just in the guardrails. Okay. And one of those landmines is prior authorizations. So it's important that as you're shopping your drug plan that you look and see if any of your prescriptions require a prior authorization, because it's not hard to get, but it is an obstacle. And you might be looking at 3 drug plans that all have the same annual cost, and maybe one of them doesn't require prior authorization for your med. So maybe that's the one you choose, right? Okay, so the other 2 cost structures is step therapy. So step therapy is a cost controlling mechanism that carriers can use. And this is part of Advantage and part of drug plans. Okay, when I'm talking about drug coverage, step therapy, you might be taking one medication, and that medication might be expensive under that company's plan. So before they'll refill it, they might say, you need to use this other cheaper medication for 2 months to see how your body reacts to that before we're going to let you take the more expensive one. That's not fun, right? Because you might have been on the same medication for 5 years. Your body is handling that medication correctly. And now you got to go to a different med for this to treat the same thing. And because it's costing the insurance company more money. So again, when you're shopping, look at annual cost, look at prior authorization, look at step therapy, because you could have two drug plans that might have very similar annual costs. Maybe they're within $50 for the whole year. It might be worth the $50 to go with the one that doesn't have the step therapy, right? So you don't have to worry about it. Okay. Lastly, the last control mechanism is called quantity limits. Quantity limits is typically on narcotics. Okay. So if you're somebody who is using pain controlled meds, like oxycodone or Vicodin or Xanax, which is another one off the top of my head, um, those have quantity limits, and each plan can have a different quantity limit. So if you're somebody who needs 180 pills a month, you don't want to choose a plan that limits you to 90 a month. Okay. You want to choose the one that gets you the 180. Now you can try to do a formulary exception for that and things like that. But again, if the annual cost is within a few dollars, you might be better off there. So I'm going to close with Medicare supplements. So again, annual enrollment, October 15th through December 7th. You make that choice. Your Medicare Advantage or your Part D plan will start January 1st. Medicare supplement insurance, you can shop all year. You can shop right now. I mean, you can shop in January, you can shop in March. Now is a great time to shop. Most of you are going to get notices that you're going to get a premium increase in January. Remember, the letter of the plan determines the coverage, not the carrier. If you have a Plan G, if you have a Plan F, or a Plan N, stop overpaying for it. Okay. If your health's been stable the last 2 years, speak to a broker or an agent, get the same exact plan for less money. There's literally no reason to overpay. Your doctor takes the letter of the plan the same. It's going to pay the same. It's not an issue. So do not overpay supplement insurance. It is honestly, you're the only people that should, if you're medically healthy enough to change, don't be lazy. Shop the drug plan. The same agent that's shopping the drug plan can shop your supplement. It's a phone call. You get it done. So, all right. Well, let me see if I have any questions real quick, because I've also got people on the iPhone. Okay. Thank you for explaining the link. Okay. Awesome. All right. So I know I went over a lot. This was a long conversation, but I am a resource to you. Feel free to Google Medicare Bob. I've got tons of content. I'm gonna go live on YouTube and Facebook throughout annual enrollment. Again, I'm gonna close with a selfish plug. We're A+ rated. We've got 4.9 out of 5-star ratings on Shopper Approved. Yeah, thank you, Bob. Appreciate it. Yeah, if you guys have any questions, feel free. The phone number that I have listed there, our licensed agents are all trained by me personally. They go through continuous training. Half of them are in training today. The other half's going in training tomorrow. If we do make a mistake, bring me aware of it. We'll get better. That's our mission. Is we really, really want to be the Medicare insurance agency that Medicare beneficiaries deserve. So if I'm not doing that, if the company's not doing that, please reach out to me. My email address is bob@medicarebob.com. That's bob@medicarebob.com. So if you have any experience that is not awesome, just email me and we'll track it down and get better. But we do a great job. Been open since 2012, and we're growing, and that's because we're doing a great job. So thank you everybody for watching and listening. I'm going to jump over to Facebook and ramble on about Medicare there. So appreciate everybody. Stay safe. And again, if you need our help, the phone number is there. It's 833-463-3262. And look forward to assisting you. Have a great rest of your day. Thank you. Oh, thank you. Thank you, Carmen. Thanks, Bob. One of your agents helped me. That makes me very happy. Thank you, everybody. Thank you so much.